is there something that we can do in order to prevent having an IUGR baby?
Prevention, anyway, we can't do anything because no mother will predict an IUGR baby. Most of the mothers, every mother, if she becomes pregnant, she feels very happy. So IUGR actually unpredictable, first thing. So to prevent malnourished IUGR, proper care, proper medicine, better not to bend. Some mothers will wash by bending. So no, that is avoidable. You should not bend. You should not wash the cloths by bending. So like weightlifting, it is not to be done. Such cases will lead to growth restriction or a premature labor also. Such is preventable. Okay. And if you become pregnant anyway, nowadays all mothers taking care, you have to go for a proper checkup. Definitely proper medicine has to be taken, iron, folic acid, DHA. DHA definitely nowadays mandatory. Mother's Horlicks, proper diet care along with the medicine care, and you have to take a proper bed rest. If the growth is restricted, if they tell your baby is not growing properly, you have to take a proper bed rest. Okay, this is how you prevent IUGR. And hypoplastic IUGR, this nowadays it's not happening. And substance abuse nowadays most common cause. Now you can't predict. Mostly after 10 years, these all teenage people will become pregnant. You will see the outcome after 10 years. So drug abuse is very dangerous. That will lead to hypoplastic, and that the outcome, even I don't know what happens at babies. We malnourished and mixed, you can't even predict. No mother can predict. So in the last trimester, this happens. Mixed means early and mid pregnancy problems, like environmental influences. Like if you work in some polluted environment, if you continuously smoke, smoking zone. Suppose if you work in a place where there is a smoking zone outside, the factory outside, continuously exposed to smoke, environmental influences, such things will induce a mixed IUGR. So that can be preventable. So if you become pregnant, you better not to work. So if you want to continue, such cases don't work or work from home. You can take like that in mixed thing. And malnourished thing, last trimester placental dysfunction happens. This thing anyway preventable. So anyway you go every month checking. So by 6 months your amniotic fluid, what is the amniotic fluid? By 7 months. Last trimester means completion of 7 months. So you will know 7 months, after 7 months what is happening to your body. You have to take a proper care because we can't expect. See anyway, like all the mothers will become pregnant, will take a proper diet. So okay, if you so IUGR, see what to do if you do not want an IUGR baby. First thing is you should take. I told you hypoplastic IUGR. Definitely you can. You have to prevent this because the outcome is very bad. So inside the uterus only better if you prevent this baby, the stress will not be there. See, after the baby comes out, for the babies also it's a stress. For the mother also it's a stress. For the whole family also it's a stress. So suppose if there is any congenital anomalies is noticed, genetic anomalies noticed. Suppose if the first baby is lost without any reason, or in the family, if suppose some families, we don't even know baby is lost at 3 months, lost at 5 months. Your co-sister, she may lose a baby. Like we don't even know the reasons. Most of the gynecologists, mostly they don't even predict because some causes will not be known what happened. In such cases, could be one possibility for hypoplastic IUGR. Suppose you itself, you have a baby, first baby could be mentally abnormal, like after that they told you torch infection is going on. So if your husband is your brother-in-law, your uncle, like in such cases you have to go for a karyotyping before your pregnancy. If you want to plan, you can go for a karyotyping. You can see if there is any chromosomal anomaly or genetic anomaly. So you and your husband, both of you go for a karyotyping. Suppose if there is an abnormality, whether to plan or not to plan, and what are the chances if you plan. All these fetal counseling will be there, fetal medicine doctors will be there, genetic counseling will be there. You can go for that. And mostly hypoplastic IUGR has to be prevented because there are the reasons, like we know chromosomal reasons, we know genetic reasons, we know. In such cases better take a proper care, but before planning. If you want your own child, you have to plan in a proper way and see to that. Suppose after 3 months amniocentesis could be done to see whether to continue the baby or not. Suppose you don't know, unplanned pregnancy happens. and you have a chromosomal abnormality. What do you want to do? At 3 months, they'll do amniocentesis, amniotic fluid they'll take, and they see chromosomes of that baby. If the baby is good, you can continue. If the baby is abnormal, it's okay. Baby could be anything like that. You can go for termination also. Better not to have such baby like that. Hypoplastic IUGR mostly you can prevent.